This is just a walkthrough on the spine skill check MMT. So I think it's important just to take some deep breaths, practicing the breathing techniques that you've learned in 103 lab and from CAT just last week. And know that you can do this. There's no question that you can do this. So you have your skill check assignment, which lives in Moodle. It was posted yesterday, which was Tuesday, and that lives in week 4. So you should all have that, and if you look in week 4, spine catch-up, right? Here's your actual, I can help you with labs on Thursday. So you have your actual assignment of what I just opened up, right? It's not due till next Wednesday, so really heavy emphasis on the fact that it's due on Wednesday at 10 o'clock, not Thursday at 1 o'clock. That's really important. And why do we do that? It gives Kat and I a chance to kind of look at these skill checks before lab on Thursday, and perhaps to look at a few sticky points to bring up if we have time. But it's just a nice, that 10 o'clock p.m. at the time that you're familiar with from Saturday. All right, let's get into so you have your assignment. So I really worked, there's a logic that goes along with this. I'm not just throwing darts in the air here. The alphabetical logic too, right? Going through and A down through the S's. We stop with several S's, lots of M's in this class. And then a logical sequence. If you're going to check lumbar flexion, range of motion, you're probably going to check trunk strength too. And rotation is most functional. So you see a lot of rotation MMTs for cervical and trunk, because those are the ones that are, again, functional, and that's how we move, is dynamic movement. And similarly, I really focused on some of these range of motion measurements that are important, the flexion and extension, and then the rotation, again, that's functional, so you see more rotation. You're measuring both sides in rotation, so please do that right and left. You want to make comparisons. That's what happens in the PT eval, and it's good to kind of use that as a framework when you're continuing treatment. So bilateral, and that's the same when you're doing the lateral flexion for thoracolumbar. So this is nothing new. We're not asking you to find goniometers, inclinometers. You're using a tape measure, which is what we practice, and then doing the MMT, which is what we practice. And again, there's a logical sequence with these. So I want to look at the skill check sheet, because I think that there has been some changes just based on the reality, right, that we are not doing 4s and 5s on the cervical spine for MMT. So red flags are the same. You're going to show us you washed your hands. It's not just going to be verbalized, I wash my hands. This is so important. These are red flags. Okay? If you're working with classmates, that they will have a mask on, prefer gloves on, would be my strong preference. If you do not have gloves, I again would question why you're doing this with a classmate with the COVID-19 guidelines and some touching, but I'm not telling you what to do, but I'm just asking that question. But you must have a mask on and prefer gloves. That's, you know, the guidelines. I don't think I need to get into that. If you're unclear, look at the COVID-19 guidelines from the CDC, and we can have a conversation about that with a Moodle message. So I prefer, right, I mean, best practice would be to work with somebody in your family, could be, partner, could be a family member that you live with, could be spouse, could be a teenage child. I'm okay with that. Or, as we'll get into it, you can actually go through this yourself. We'll get to that in just a minute. We'll talk about that in lab tomorrow more. So stay tuned. Take a deep breath. We're going to be okay. Treatment preparation. It's, you know, yes, you're working at your home, but we don't want it to look like, pardon my French, but a pigsty. And I grew up with pigs, so that's a figure of speech that makes sense to me. Although pigs are fairly clean, actually. But anyway, I don't want a lot of straw and things around their back out area. It needs to be clean and a treatment area, just like if you're working with someone in home health. You'd want to have a safe place to work. They're not tripping over, you know, cat toys, dog toys, kid toys, clothes. And communication, that's the same, right? You're going to use patient-centered language. So that's important as you're explaining your procedure. Efficient use of time. This shouldn't take long. You're only doing 1 MMT and 1 range of motion. So this is a range of motion section worth 15 points, similar to what you were doing with the knee and the hip and ankle. So position the patient in that preferred testing position, or yourself. You can videotape yourself in that preferred position if you do not have someone to work with, right? Exposed joint or patient exposed joints with proper draping is needed. So again, if you don't have somebody, you can expose your own joints. And we're talking about the spine, so you're going to have to show some bare skin, okay, or a tank top, just like we've practiced. Or if you have a gown, put on a gown. If you're doing lateral bending, you want to wear shorts, again, just follow the book and the videos. It really, I think you got this. You got this. Follow your videos. Follow what we practice. So you're going to active range of motion, either have your patient or yourself go through that motion in that correct position. You're going to describe how you would gather this information if you don't have a patient. You know, I would have the patient do this. You're just going to verbalize, right? It's like you're teaching somebody how to gather range of motion. It's like a little teaching video, right? If you're doing this with yourself, mimicking the patient. Just prevent or describe how you correct substitution. So in other words, if you have a patient, you don't have to say, well, I do this, but you're going to prevent them from moving, which might be stabilizing their legs, as the video showed, as they're going through trunk flexion, right? They're going through rotation if you need to provide that stability. And I provided videos on that with me working with Steve, so you have that archive as well. Maintaining proper alignment. Again, this is range of motion. I kind of am jumping ahead, but how do you prevent substitution? Well, you saw in the range of motion how Steve was substituting. He was going way too much into trunk flexion. He wasn't doing pure rotation, right? When we were doing thoracolumbar rotation, he was rotating and flexing too much. So, if your patient does that, say, oops, let's correct this. Or if they do it and you miss it, just say, you know what? My patient flexed too much. I was doing this again. So, you know, you can correct yourself by saying that after you're done. This is what I would have done. This was not correct. So, in other words, if you don't have the time to do another record again, you can jump into it in your typing and say, you know, or verbalize within your recording that my patient substituted, and I recognize that. But best would be to correct it while it's happening. And if you're doing it yourself, you would describe what substitution. You're doing it as you as the patient describe what substitutions would work to prevent. Make sense? Okay. And then we're getting close to 10 minutes already just on this. And maintaining proper alignment and eye level. And I'll do another one for MMT.